Good evening, everybody. My name is Franklin Laufer. I'm the Associate Director for Medicaid Policy and Programs in the New York State Department of Health AIDS Institute. It's both an honor and a pleasure to introduce AmitaCare and its President and CEO, Doug Wirth, as the recipient of the Foundation's 2015 Spirit of New York Award. I don't think Doug will mind my saying that the AIDS Institute shares a little bit in this honor, as the Institute had a hand in the creation of AmitaCare and the two other HIV special needs plans currently operating in New York City. These plans were formed out of concern that people with HIV who are covered by Medicaid, many of whom suffer other conditions such as hepatitis, continue to receive the same or even better medical and other health care as New York State transitioned its Medicaid program from the traditional fee-for-service framework to managed care. AmitaCare certainly exemplifies what the Institute envisioned for this population. What best describes AmitaCare is the commitment of the plan and its network of medical, behavioral health, and community-based providers to the health and care of its members. The plan has operated within the 5 boroughs since 2003 and currently covers over 6,000 members through its Medicaid and Medicare programs. It has accomplished many impressive outcomes for its members, over 90% of whom are engaged in care. A high number of plan members are on their medication regimen, which in turn has resulted in decreases in hospital admissions and readmissions, and increases in the number of its members whose HIV is virally suppressed. However, I would be remiss if I didn't take this opportunity to say a few words about Doug. Without giving away his age, let's say Doug himself has a similar and long-standing commitment to health care. He hails from the Midwest, where he ran 5 homeless shelters and also successfully co-located a meal and food pantry program with a work readiness project, a satellite primary care clinic, outpatient substance use programs, and mobile HIV testing. And although Doug went on to serve as Senior Health Policy Advisor to 2 New York City mayors, while also chairing 2 committees for the New York City Health and Human Services Ryan White Planning Council, and also served as Director of Government Relations for the Coalition of Community Mental Health Agencies, it's what Doug experienced and accomplished during his work in the Midwest, which he taps into to inform and guide the mission, goals, and operations of AmitaCare. In closing, I extend my congratulations to Doug and to the rest of the staff of AmitaCare on receiving this award, and of course my congratulations to the other honorees as well. A short video now will be presented in which you'll hear from members of the AmitaCare family, both staff and its members. Much better than I ever could, you'll now hear from the people who, through their stories and experiences, can impart to you how AmitaCare exemplifies the essence of the Spirit of New York Award with which you honor it tonight. Thank you.
So AmitaCare is honored to receive the Spirit of New York Award from the American Liver Foundation of Greater New York in recognition of our work to improve health and well-being for New Yorkers living with multiple chronic conditions such as HIV and hepatitis C. I especially like to thank Frank Laufer from the AIDS Institute for being here tonight. As you heard Frank tell so eloquently, it's because of the vision and the leadership of the AIDS Institute that a special needs plan focused on advancing care and wellness, that model exists in New York. As you've just seen from the video and the members' stories that were shared, AmitaCare provides specialized care and support to people with complex needs. Our staff, many of whom are here tonight, strive every day to go above and beyond to support our members. But we're more than a health plan. We're actually a wellness community. Through our integrated care team model and special programs like those Live Your Life events, we address the full spectrum of needs: physical, psychological, spiritual, social, and emotional. Medicare is advancing a healing path that empowers people to get beyond chronic illness and get back to the business of living their lives well. Our staff and network of providers work to address social determinants of health, like housing stability and food insecurity, two key impacts on vulnerable New Yorkers and communities most in need, people that we serve in our Medicaid and Medicare health plans. Medicare was founded in 2003 by community health centers that recognized the need for specialized care for people living with HIV. And over the years, we've expanded our special needs plan to address other areas of great need, like hepatitis C, serious mental illness, and substance use disorders. We firmly believe that our members deserve access to the full array of treatment options, preventative medicine, and support services. By positively impacting health outcomes, we've saved taxpayer money now, and we're preventing future costs. But most importantly, we help to preserve and enhance the quality of life for fellow New Yorkers. Exciting medical advances in recent years means HIV can now be virally suppressed and hepatitis C cured. In 25 years of HIV work, I've talked a lot about a cure, but a real one is here right now on hepatitis C. We're proud of the outcomes we've produced, both in saving lives and producing healthcare cost savings. 93% of our members in regular care, 74% decrease in hospitalizations, a 70% viral load suppression among people who are HIV positive, and a Hep C cure for over 400 Medicare members. We're grateful to our sponsoring community health centers like Brightpoint Health and Harlem United, who are with us here tonight at table 19, as well as our network of providers, including Montefiore, another great supporter of tonight's gala. Your collaboration with us makes these outcomes possible. You, providers, you're on the front lines. We couldn't do what we do without you. We couldn't impact Medicaid redesign, end the AIDS epidemic in New York, cure hepatitis C, or provide members with specialized care, services, and support. Thank you, the American Liver Foundation of New York, for this honor, and congratulations to other esteemed and accomplished honorees. Good evening.